So, EGP learners, in this episode of Epic, I'm joined by Dr. Ankit Kant. How are we doing, Ankit?
I'm really good, thank you. Great to be here.
Great to hear you. So, why don't you introduce yourself to our EGP learners out there?
So my name's Ankit. I'm a dispensing GP partner in semi-rural Norfolk. Been a partner for 10 to 15 years. Additionally, we're dispensing, but we also have a pharmacy attached to us, so we run the pharmacy. That's what I do.
Cool. And I know you do a few other things around the dispensing as well, don't you? I remember you telling me, but was it Dispex or something else?
Yeah, so I also am one of the directors of Dispex, which provides education support for dispensary teams, and we provide some supplies as well to NHS dispensaries.
And I guess another area that we've met in is, I know you also teach on the Medics Money New to GP Partnership course, like myself and stuff. So shout out to the guys there. I know it's a great course and stuff. Love their work they're doing and things. And I know you've enjoyed it as well, haven't you?
Absolutely. No, I think it's a great community on the Medics Money team. Yeah.
Cool. So the whole point of Epic is trying to understand how people have done changes in their practice, in their area, and basically how they made it happen and things. So I guess I wanted to hear part of the journey that you went through. There's something specific that I know that you talked about. That I believe me and Andy triggered. Tell us about it.
Yes, that's right. So a few years ago now, our fantastic senior partner, who was a bit of a legend really, he retired. And I was kind of juggling, how are we going to cope without such a significant member of the team leaving, and trying to work out how I could keep track of all of the unseen work that he'd been doing for decades. He was the kind of individual that could just kind of know what's going on in the organization with only a few words, and could kind of juggle it all together and set the course for the organization. So I came across a video from you and Dr. Foster, and it was all about measuring objectives. I think it was part of a New Year review and kind of goal setting, those kind of things. And it was fantastic. So I stole the idea and kind of plagiarized it, and then worked on developing our own version, which we in-house call our key performance indicators. And it was a way of tracking everything that's going on in our organization. So because our organization does have a dispensary and a pharmacy, we probably have twice as many members of staff as a typical GP surgery does. And just from a commercial point of view, we probably have 2 or 3 times the turnover of a cash turnover in terms of a typical surgery. So trying to kind of keep track of all of those different channels was really difficult. And so part of the video was actually just setting some very simple goals or simple metrics that were measurable and tracking them month to month. So what I did was I sat down with my practice manager, and we sketched out what we thought would be useful for the partners to kind of know each month, and things that we could track that would benefit all of our teams. So it took about 6 months. We worked on splitting up each of the teams down into sections, and came up with what we thought was a good start. As an example, for our reception team, we would be doing some of the tracking of how many referrals might have been processed by them, adding in how many 2-week wait referrals were done. We would be tracking the number of complaints or compliments that we'd be having, and just starting to kind of build for each department good metrics that would decide, is a particular department struggling? Are they is there unique things that we could go in and try and solve? And over the course of 6 months, this developed into kind of a 6 or 7 page document where other members of the team would start adding in extra things. So, one of the things that my practice manager came up with was each department would then say, well, what's their 3 oldest policies with their date? So we could then make sure that we're up to date with all of our policies. And if we're not, what additional support we could give to those team members to kind of make sure that they do have the time to make sure things are updated. And then somebody came up with the idea of, well, why don't we track some of our enhanced services? Are we coding correctly? So we've got a section for quarter. We get paid quarterly, so tracking, are we doing phlebotomy, and are the payments coming in? Are we tracking all of the key ones? And if not, it allows us to kind of jump in a little bit earlier and say, right, well, maybe we need to give a bit more support there, or have we not updated one of our templates so the incorrect read code is going in? And what came out of it was kind of the 7 or 8 page document, which changes every few months, but not all of the partners are in every single day. And it means that our management team, our practice manager, doesn't necessarily have to keep having the same conversation 3 or 4 times a week. And when we do sit down and have a partners meeting, it's actually a lot more focused because we can really drill down into some of the data to kind of say, right, well, these are some of the riskier areas for the organization, and these are some of the things that actually we need to congratulate the teams on.
And I guess coming up with that list, I mean, I can imagine when you first sat down and did it, it must have been quite a big list of stuff you could look at. How did you narrow it down to, I guess, the more specific things that you wanted to focus on?
So that was down to having a fantastic practice manager, because I'd want everything on it, and she was very good at saying, "No, Ankit, that's not useful, and actually, it's going to take a lot of time to get that kind of data, and it's going to give you minimal information." So we kind of compromised and said, "Okay, well, let's pare down the list into quite a short, manageable chunk," and we added a comments box, and actually, we encourage people to just put some comments in there, which is what they feel is important for that team. And actually, that works really well, because allowing people to have free text, the heads of departments to have free text boxes, is often the most telling when we're looking at metrics.
Okay. So is this mainly captured through like a document, or is it a different route that you use?
It's a simple Word document, and we just have the last 4 months worth of data on it. So it's just a simple column. Yeah.
Cool. And I guess when it came to implementing that itself, I guess first of all, what would you say were the top 3 challenges you had with trying to bring that into the practice?
I think the first challenge was understanding that there was a need for this kind of information, and because the practice had run so smoothly beforehand, and I was kind of faced with, well, how do I make sure it carries on, and how do I kind of convince people that this is a useful thing? So I did speak to the outgoing partner, and he thought it was a brilliant idea. So it was good to get that kind of approval from a institutional memory point of view, that these are the things that work. So getting the team on board. I think the second challenge was having the right amount of time, as always in general practice, to prioritize this as a thing that would help us, because in the short term it makes very little difference, and it almost feels like it's an additional bit of work that isn't necessarily going to show much value. So bringing people on board on that stage. And then thirdly, the challenge was actually to keep it updated, because the organization changes so significantly. There are so many more hoops to jump, and other things get retired. It's just to make sure that it still is relevant. And I think the key to that was actually just paring it down and not having as much information. So I guess listening to the practice manager is always a good way to go.
Yeah, generally good
Yeah.
lesson to listen to your practice manager and stuff.
100%.
Yeah. So I guess with how that process went, we talked about some of the challenges. What about the highs? What were the things that surprised you in particular that went, I guess, better than expected?
I think what was really useful was that the number of perceived complaints that I think as an organization you dwell over, that complaint or that thing going wrong, was actually a lot less than we had imagined. Because I guess every time something comes in, you kind of replay it and go over it. But actually looking at it over the course of 6 months or 12 months, and looking at the number of compliments, and just seeing generally how the organization seems to be doing, it gave it was a lot of perspective, actually. And I think that's what was particularly useful. The other high, I would say, is keeping track of our enhanced services, and finding out much earlier than we normally would that we were doing all of this activity, but we weren't actually coding for it correctly, or there was an issue in that process, and being able to fix it in the same time frame, so we would get the resource allocation that we needed.
And I guess doing that continuously throughout the year, like you said, would have made that much easier. I guess with
Yeah.
that, did you use the systems to kind of get the information, or was it more the payments that you're using
So
to get
so it
everything?
was we would kind of have a, this is what we predict we should be receiving, and this is
Hmm.
what we received. And so we could then marry up what kind of the differences are, and alarm bells can ring really early on as well.
Okay. And I guess with that, any tips that you can give in terms of how you encourage the team to support you on this? Because I can imagine that, like you say, it's a little bit of extra work that may not have an immediate impact on how people cope and things. So how did you navigate that with the team and things?
I think it's making sure that I think actually thinking about it is, number one, not launching your first version, because the
Mm.
first version is not going to be very coherent. So I think spending the time with the practice manager or the senior team to kind of think, well, actually, maybe as a partner, these are the kind of things that I really want to know.
Hmm.
But actually, the practice manager might have really key bits of information that they feel that we need to know. And actually, the rest of the teams, the department heads, might feel that this is important. So I think spending the time to start with a version that everyone seems to be on board with, and then regularly reviewing it to make sure that it still reflects what the organization needs.
Cool. And I guess if you had to give one lesson or one major tip that you had as going through this whole process and stuff, particularly to someone who's interested in maybe trying to do the same thing or similar thing, what would that be?
Um, think hard about what general practice is going through at the moment, because I think it's harder than it's ever been.
Hmm.
And the way that I think we can look after our teams is making sure that we get the business side of things right, and we use that to make sure that we get the patient care level correct as well. So for me, sustainability of a practice comes down to making sure that you know what's going on, and you need to understand which are the key bits of your organization. So identify them and track them in a meaningful way. I don't think this should ever be used in a negative way. I don't think we
Mm.
should be uh, tracking metrics which are used to kind of hamper teams. It should be used always just to support them.
Hmm. And what's next for Dr. Kant then in terms of the next kind of implementation plan that you've got?
Oh well, it's more of an organic document, to be honest. So it does
Mhm.
change every few months. We do add a few different things. From a dispensing point of view, there are a few changes that we're now tracking, and that's made significant savings and efficiencies to the organisation. So, yeah, I think it's every 2 or 3 months, just sitting down with the practice manager and just saying, "What about this? And is this useful? And is the data readily available for us to track?"
And I guess if people did want to find out more about how you went through this process and stuff, or possibly even get a template of that form,
Yeah.
is there a way for them to contact you to do that?
Yeah, they can contact me on Twitter. That's fine. I'm on Facebook as well. Please do. If you're a GP partner and you're on the GP partner Facebook group, then my template is on there as well, so you can just find it straight away.
Absolutely. We'll put the links of those down below in the show notes and stuff. So people do want to get to those details, do use it from there and stuff. Thank you very much, Ankit. It's been great hearing about this process, and I really like hearing about it. I know it's something that Andy was really passionate about and then
Mm,
continues to do. I must admit, it's one thing I've not done, but hearing this
right.
and how much a bit of a benefit, I think I might actually go ahead and do it for
Oh,
myself in my
fantastic.
practice and stuff. So there you go. You've got myself implementing it as well. So yeah, really good to hear from you. As always, EGP learners, if you want to know more of this kind of stuff, do make sure you subscribe to the channel, because then you will get to hear this stuff. And it's exclusively for our podcast listeners as well. So do subscribe, whichever platform you're listening through, whether that's Google Podcasts, Apple Podcasts, Spotify, etc. And if you're interested in doing this, do apply for the Epic podcast as well. Links to that are down below as well. Thank you very much, Ankit. Had a great session, and we'll catch you all soon.